Yeah, Phil. What would you like describe that as? Would it be healthcare worker or like how would you?
I describe it as healthcare worker. Like if you're looking like a professional term, they call it allied health. So like techs, so like CMAs.
Oh, that's foreign to me. CMAs.
So
I know what CMB is.
So CMA, that's what I do. I'm a certified medical assistant. So you have like CMAs, you have CNAs, certified nursing assistants.
CNA, that's the top. That's the top one, ain't it? Ain't that everybody is?
Well,
right?
you have RNs, which is a
okay.
registered nurse, and then CNAs. A lot of times people forget about MAs. A lot of people really don't know what it is, like how you just said, well,
Right.
What is that? I don't know. But like we are like a forgotten person in the healthcare field, but we're very important because we run like doctor's offices, we run prompt cares. Like when you go in there and see those type of people, those are like me.
Got you.
So
See, I did that on purpose. I want you to just start talking. You got comfortable. So I'm going to go ahead and start. I never do that, but I never go ahead and start it.
Yeah.
Mic check. One Masters Podcast, your host, main, of course. Of course, I got a special guest, Miss Auyanna. I'm not going to say your last name. I'm just going to say Auyanna, okay? Cool. We're going to consider you a healthcare worker, but I lie. You just gave us the whole backstory on all of that stuff, so shout out to you for that. With this particular episode, before I get into it, I want to say it was your post that made me want to do it anyway. But I always wanted to get into something with healthcare, just talking about what y'all go through in there. Mm-hmm. This past, I'll say maybe 10, 12 days, I work in retail, and where I work at, like, almost like you said, like it could some positions could be forgotten.
yeah.
And I think the regular customer service associate or just your average, not the top dogs or the managers, but the workers, you know what I'm saying, the foot workers and things of that nature. I definitely remember them last week because they wasn't there because they was all sick or maybe sick, whatever, just out due to COVID, right? And for the past 10 days, like, I ain't been stressing, but more so just like tired because I'm doing more stuff on top of what I'm doing. And then it's just like how we going to business, how we going to meet these numbers, meet these metrics, because they still want the business to run smoothly, even though there's nothing smooth about it right now.
Yep.
And then when I saw your post, I was thinking, I started like sitting back, just thinking like, damn, you know what? I'm here complaining, upset, and just, stressed out, tired. But it's people like you that deal with it on like the front end, like the front line of everything. Like they can't even call me and say I can't come to work until they meet y'all.
They come see
you know
me.
what I'm saying? Until they bother y'all, rather.
Yeah.
You know what I'm saying? So before we get into all of that, I want to kind of just talk about you and your in your profession. So about how long you been doing that? What got you into it?
So I have been MA for going on 5 years.
MA, I'm actually.
So medical assistant.
Okay.
So certified medical assistant. So there's a couple ways you can become a medical assistant. I mean, obviously you go to school, but you can either get a certificate or you can get a degree. I have an associate's degree in medical assisting.
Okay, shout out to you.
And thanks. And my ultimate goal is nursing. So when I started out my college career, like everybody else, going to a 4-year university, figured out that wasn't for me, but I figured out how I could still get into like the healthcare field and doing what I like by taking an alternate route. So I researched, found out about medical assisting, went to school for that, and I've been doing it and loving it ever since.
Before I get into more of that, you just spoke on something, and I always try to educate anybody that's watching. For like kids in high school that kind of want to be in the medical field, like I don't necessarily want to push somebody away from college or push them to college, right?
Right.
But I do think it's important that they are familiar with them alternate routes.
Yes.
Because college is not particularly
College
for every
is
single
not
person.
for everyone. 4-year college is not for everyone.
Right.
And if like a child that's watching this, if you feel like 4-year university isn't for you, that's okay.
Right.
Like there are different ways to get to your goal. It may take you a little bit longer, which is okay, but you're still like trying to reach that ultimate goal. Tech school is okay. Getting a certificate is okay. Like anything to better yourself other than a 4-year university is okay. So don't feel like you have to, stress yourself by going to a 4-year university to try to meet that goal or to appease to, someone else who's
mainly their peers too.
Their peers, their parents who feel like, oh, you got to go to a 4-year school to be somebody or to make it somewhere, and that's not true.
It ain't nothing like your friends. They go enjoy the state. They go enjoy the Southern.
And
you
graduating.
But you like, oh, I'm going to Augusta Tech. And it's, like,
right.
It's okay. Like, it's
okay.
fine. But
You're
I guess
still doing something.
At that age, it's hard to really.
And for me, it was seeing, all my friends go off to a 4-year college. It was like, oh yeah, I'm finna go. Like, I went to Georgia Southern with everybody else, but I didn't end up graduating from Georgia Southern. I had to take a different route, which is okay, and it has gotten me to the position that I'm in now, and I love it.
Let me ask you just real quick on that. Like, would you, at 18, when you wasn't a senior in school, would you have done it that way if somebody said, well, just go here, don't go to Georgia Southern? Or did you like want to go there too because you're friends and like...
Oh, of course. Okay. So it was definitely a peer pressure type thing. Right. It was a image type thing. Like, no, I don't want to do that. Like, they going to look at me and say, ew, she went here. Like,
I didn't want to go to college, right? And I was really smart. They kind of made me go, but that's another story. But like when I remember it's somebody who's really successful now too, and shout out to her. But I went to Checkers one night, and it was like, summertime. You know how you finish school, and she's like, oh, where you going to school? I was like, I'm going to stay. And she was like, oh, it's okay. I was like, okay. What the hell was that?
Like, what does that mean?
I never forget that because like, what?
Because you didn't go off somewhere?
Yeah, I want to go there. I didn't want to leave, but it just was like, oh, it's okay. I was okay.
Yeah.
Give me my damn food. What's wrong with you? But yeah. Anyway, so and you just also for clarification, you graduated from Laney.
I did high school. Yeah.
Okay. And everybody know I always joke on Laney and stuff like that. But one thing I always say, they do have a strong alumni. So even talking to you right now is really dope because you can still educate somebody that did go Laney, or whether they didn't go Laney or not. But Laney alumni do watch out for Laney alumni, and I think that you giving this kind of information is amazing too for them.
Yes. Shout out to class of 2012.
Yeah, here you go.
That's what. Yeah.
All right. Nah, but shout out to Laney. All the schools, honestly, but definitely Laney. I like the alumni, very strong, and they always reach back and help others, whether they're from Laney or not. So, all right. So what? And so you've been in the field for 5 years now, right?
Yep.
So can you before, like pre-COVID, can you kind of describe to me what it was like when you finally got into that field and just doing what you do?
So when I graduated, I was working at Teleperformance. I hated it.
Yeah, but I say sorry to hear that, man.
Like, I hated it. I was trying to put myself through school, finish school. So I was working like late night, doing homework during the day, going to school during the day. Finally graduated. And like I said, being an MA is kind of forgotten, but we go through the same thing that every other healthcare professional does. We have to go to school. We have to sit for like state board exams. We have to pass licenses and things like that. And finally passing all of that, reaching my goal and getting into the field, like, it was the best.
Definitely.
It was the best.
Did you start out, like, so when you finished, you graduated, did you start out in, like, the urgent, I'm assuming you work in urgent care type?
Yeah, now I work in urgent care. When I started out, I started in primary care. Okay. So I was...
What's the difference between the two?
So primary care, I was a 9 to 5, Monday through Friday. I saw the same patients on a monthly rotation, whether it's 3 months, 6 months, to treat their chronic issues. So high blood pressure, diabetes, things like that. I saw those people on a regular basis.
So primary, would I be doing that if like that's just my doctor I go to?
That's just my doctor that I go to. Like when they ask who's your primary care physician that you see on a regular basis for maintenance
you got the
issues.
Checkups.
Yes, okay. That's what I did originally. But prompt care is a like one-off situation. Like, oh, I cut myself, let me go here instead of going to the emergency room. Or I think I got pink eye, let me go here and get treated instead of going to the ER. So we treat like little minor things. I mean, big things too.
They go for anything, honestly.
Honestly, it goes for anything because people do see us as like a baby ER. So like, let me skip the 12-hour wait. And let me go to prompt care to try to hurry up and get seen and come back out.
Right.
And sometimes that's not always what we're there for, but we try our best to take care of everybody no matter the situation.
And I'm sure we'll get into it more in like as time comes we conversating, but I would assume too they get more you get more upset patients there because they assume it's supposed to be quick and easy and I'm supposed to go in and out, which I've had very quick and easy urgent care, and I've been there for a long time too. So, yes. But I assume they get more upset. Like, why am I here so long? I come with the ER for all of this.
Yes.
And now you gotta deal with that.
Yes.
So, but So were you working in urgent care like before COVID came through?
So I left primary care about October of last year. So I kind of went into the urgent care mid-pandemic.
Okay. But it was kind of calm.
But it was calm at that moment.
When we all thought it was going away. Like, okay, we're good now.
Yes.
Okay.
I went into urgent care when the pandemic kind of, started to subside some. We thought we were going to be okay. Nothing. Oh, we're over it now.
Right.
And then it started to spike back up. So I definitely can compare last year and this year and seeing the symptoms from last year, seeing the symptoms from this year, the number of patients we're seeing, it's kind of repeating.
Well, let me ask you more so on the prompt care side too. I didn't even think about that. I always thought you just did urgent care, and I should have known because you never really voiced too much opinion about work that much. You know what I'm saying? Until of recent. So it makes sense now. But with prompt care, right? What were y'all thoughts on the pandemic? Like, was it still smooth regardless the whole time because of the prompt care? Did you have to alter anything because y'all were just a primary facility, or like how did y'all have to deal with COVID at all?
So, when I was in primary care?
Yeah, primary.
Okay, so when I was in primary care, we did have to alter things. We just became more cautious. Patients had to make sure they wore their mask. We had to kind of screen them prior to them coming into the building because we tried to keep COVID out as much as possible. As far as prompt care, you gonna get those sick people that come in that's infected with COVID, and that's just what it is. But primary care, we try to screen those patients.
Got you.
If we suspect that they may have those symptoms, we kind of brought them in through the back door type thing. Don't come in the waiting room with everybody else who just come in here to get a blood pressure meds refill. You got to come through the back.
That makes sense because even in most when I take my kids, you got and it's we take them primary doctor, but you got a side that's healthy
side
and then the sick side, right?
Side, yes.
Okay, so that I was asking for that reason. Did y'all ever have to take temperatures? Kind of when we started opening things up, most facilities was all right, we taking temperature. If you over this, you can't come in. Type thing.
So at one point when COVID was beginning at primary care, my whole job was to sit at the front door, take people's temperature, and okay, you good? Oh no, you gotta wait.
So actually, what? And I hate using this word 'cause I feel like it's so corporate. But what's that verbiage like when you have to tell?
When you have to tell them, so it's kind of
you can't come in through this side.
We sitting here, and you come up and okay, let me check your temperature. Have you been in contact with anyone with COVID in the last 14 days? Have you traveled outside the United States in the last 14 days? No. Okay, you're fine. Yes. Okay, well, stand right here. Let me, check with your physician to see, what options we have for you. And then I'll come back to you to let you know what we can do for you.
Right.
Most of the time, or we would just, take down your phone number. Just have a seat in the car. We'll call you with some updated information.
It's not funny, but
it's kind of get out.
Got you. And it's one of them things where boy didn't pay to be honest, right? It's I should just say no.
And
but
even
I
now,
like that,
even now, that's the biggest thing. Honesty in healthcare. Please be honest, y'all.
It's a meme floating around right now. I don't know if you've seen, not a meme. That's just a picture floating around. And I don't know if it's an airport or airplane or what, but it's a woman clearly on her phone texting somebody saying shh, we have COVID, right? And I'm like, whoa, why this?
We see it all day.
I think it's on Twitter. That's what it was on Twitter. But
we see it all day.
That's wild. But yeah, honesty is definitely it's always been important in health, but it's more so now because you can affect so much other people.
Yes, because you're putting more people at risk when you're dishonest, and I'm not understanding why people feel like their COVID status has to be a secret.
True.
It's not like any other part of your health, your medical record,
right?
But your COVID status, you should be honest whether you've come in contact with someone or if you have or could potentially have COVID. Tell people, be honest about it because you're endangering other people.
I see it where people are either not being honest about it and endangering people, and then they're also not being honest about it, and they're just sitting back, just collecting this bread or whatever. So I always see dishonesty on both sides. It's very rare somebody just being truly honest, like I was in contact with such and such, this is what happened or whatever. And like I said, it's always in a rough time because you don't know what's like. I don't want to question somebody about it. You know what I'm saying? Like that's it. I got some time last week from somebody saying, I'm like, yo, you wasn't even around this person. Like, why are you asking about this person for? But at the same time, I want to let that person know, like, yeah, they, but I have violations. I can't say certain things.
You can't say certain things.
But obviously, they go on social media and say, oh my God, I got COVID, and we all work together. Like, yeah, they gonna know you got it. Right. And they asking me, I'm like, I don't know, ask the person, But yeah. So is it any at least for y'all, like, is it any, I guess, stipulation with what you can share as far as that kind of information, or is that like top secret?
Like
is it confident?
Coworkers?
Yeah.
Oh no, we're very open about it. Like if we don't feel good, we'll look at it like, girl, you better swab yourself. Like check in at the front desk, and we'll triage you, get you tested just like everybody else, because we're around it all day, so we know what the symptoms are. We know how you're feeling and things like that. We can pick up on it. So they coming in dragging, sniffling, and we kind of side eyeing you like, okay girl, you okay? Like we need to check you in.
You can't cough no more now, so
yeah, no, you can't cough no more. You
remember when we was younger, and like I know everybody had a situation, I'm pretty sure. I don't know how women are with it, but like you're younger, you're in high school, whatever, and you're trying to hold your cough because you don't want to be coughing. Just because you got the cold. Yeah. It's like 30 times worse now. Yeah. Like you can't even cough at all. Yeah, you
cough, sneeze, and it's kind of like,
like what's going on? Right? Exactly, for real. Like
you need to go to the doctor.
You can't cough at all now. So it's worse now. No. I never thought it could get worse than that particular situation.
It's worse now. Coughing, sneezing, clearing your throat. It's kind of like, you okay?
Don't do that. It's like, whoa. It's a lot of saliva going through your nose, bro. What's going on?
You sniffling? You all right? Yeah, you can't do none of that no more.
So, all right. I guess I'm gonna ask you this before we get into the actual urgent care side of things too. Like, I guess what decision went into you going from one to the other? Like, because I don't know, like it sounded like the other one was a little better, even though you haven't spoke on the urgent care side of things yet. Yeah. I would just assume it. To me, I'm looking at like somebody picking to go to, I'm gonna just say Josie Laney area versus you going to Evans or Greenbrier. Like, why would you leave?
So
over there?
Yeah, it kind of feels like leaving from Columbia County going to Richmond County. Right. But that's something I always wanted to do, only because my ultimate goal was to be a ER nurse. So a step down from that in my field would be like being an MA in a prompt care, because you never know what's going to come in. Like it's spontaneous all day, every day. You never know what you're going to get. So going from, 9 to 5, Monday through Friday, off on weekends, off on holidays, to working 12 hours every day. I mean, it's just something I always wanted to do. So it's
12 hours.
Yeah, I work 11 hours, 12 hours too, sometimes.
But they say 11, but it's always 12.
But yeah, they say 11, it's always 12. And lately during the pandemic, it's been 13, 14, 15 hours. We get in there at 8 o'clock. We're not leaving till 9, 10 o'clock at night, seeing 130 patients a day. And people ain't like, y'all not understanding how many people we're running into and coming in contact with daily. 130 people each day that we work. That's a lot of people.
So, and before I get into that too, you have a child. So,
yep.
What's that like? Like, what's the scary there? Cause I got 2 daughters, and their mom always been she's the type of person, like she's like overly like protective on that side. Like she want to go to the ER for anything. I'm not. I just can't do it. I have to literally see you about to. Like, all right, we'll go. So even now, like me working where I work and her working where she work, because we both come into contact with a bunch of people. She always was like overly, and I respected that, because I'm not that type of person. Yeah. So like how do you deal with that in your field? It's
easier when you have that medical mind.
Got you.
So it's like I can assess when she just needs some over the counter cough and cold medicine, or when I need to get her to her doctor. Gotcha. So it's a little bit easier when you have that mindset versus being that parent that panics at every moment when your child coughs, sneeze, and you like, oh, take them to the doctor. Like, no, just.
Well, the good thing is, I guess too, you work in urgent care. She could kind of skip the line. I guess she could just come back there, right? She could just come to work with you and get a test.
No comment.
Yeah, I got you. You're right. I mean, me personally, I was like, hey, just she's
so
first on the list.
what you would do is
definitely, I would definitely do that. Like, why not? You know what I'm saying? You know what? Just come to work in the morning. It'll be all right. But not. And I asked that because but also on the other side of it, I guess too, people like regular people like me or who work in my field, we don't have that same kind of structure y'all have as far as as always being safe, health related. I come in contact with a lot of cash. I was just telling people I worked with last week, yo, when we go in the cash room, we need to start having gloves on because we touching this money and we don't know where it's coming from.
You don't know where it's coming from.
But I might count the money. I might scratch my face 10 times since I've been here. It don't itch. It's just something you do, right?
Yeah.
But that's how you can end up sniffling and stuff like that. But how y'all said it before COVID, y'all always been washing your hands 30,000 times.
Yes.
Gloves. So it's definitely different for y'all, I guess, too. So I guess even if y'all still come in contact with it, y'all take care of yourself a little better than most.
Yeah. But I mean, like you said, we're always practicing safe healthcare. So hand washing, mask, depending on the patient, full PPE, so gown, mask, face cover. I know when COVID first started and we didn't know what it really was, how it was contracted, how it was spreaded, you can just wear a mask and be 6 feet away, you'll be safe. Before we didn't know that, so we're donning in full PPE, gown, mask.
I seen a picture on
whole thing
on Ultimate Facebook. I don't know, it might have been Kira that shared it. She was like, I knew something was wrong when they told you I was airborne and y'all bought all the tissue. Yes. That was funny. Because it really didn't make no sense now I think about it. But
what the tissue ain't gonna save y'all.
Yeah, they should have bought masks. That'd been a smart thing to do.
A mask, yes.
Which is funny. My dad actually came down, lived down here with me for a year. Right, and COVID might have came out in March. It came out before the album, but we knew about it in March, something like that. In January, December, he would wear a mask. I can't bring him. He just always wore a mask because he don't want to smell smoke. He don't want to, And I was like, damn, we should have bought some stock in masks. Masks have been a thing about stocking, or make your own brand of masks. That would have been the best thing to do.
And you people were hoarding them, buying them up and buying them off from Amazon and then trying to sell them
America.
Marking them up.
Yeah,
people was making money back then, being smart, but
I just kept taking them from my job and I just put them in my car. Take a box at a time.
I mean, at some point, we even it became difficult for us to get medical equipment. It was difficult for us to get masks in. It was difficult for us to get gloves in. We had one glove. You're only using one hand. Use one glove. So
you gotta start putting inventory on that thing.
Yes.
Man. So, with the urgent care, right? So you came around. You say you started working in urgent care around the time where it was kind of mild, right? Mm-hmm. So what time was that? Last November, you said?
So this was, I started in October of last year.
But y'all was giving out y'all still was giving out free vaccination. Y'all was giving out.
So
not everybody, but I know some urgent cares.
They had little sites set up for that. We particularly didn't. The only thing that we gave out were flu vaccines. Mm-hmm. So that's something that we do every year. We do offer flu vaccines. But as far as COVID vaccinations or anything like that, we have never been able to offer them to the public.
But when you first got there, how was it in that field, working urgent care? Not take COVID out of it, because I want to get that whole conversation separately. But
so I mean, just jumping in,
that's the people you seeing.
It was everything I thought it would be. Seeing different stuff every day. I mean, you have people coming in having chest pains. You gotta try to hurry up, get EMS there because they're having a heart attack. Passing out, coming in with lacerations. It was everything I thought it would be. Baby ER, seriously.
So sometimes people come in chest pain and y'all got to call an ambulance?
Yeah, we have to make sure they don't down us until the EMS get there. Sometimes, working in urgent care, we've had people die on us in the office.
Oh, damn. Did not know that. I did not think somebody would go there that's about to die. I would think that'd be the time to go to ER.
And that's... We also try to teach that as well, trying to get people to understand the difference from coming to a prompt care and going to an ER. Sometimes that difference can save your life. as far as time wise.
Right.
But when you come in, if you're in like any type of distress, of course we do everything we can. We're trained to use AEDs, to do chest compressions, to, administer epi and things like that if needed. But ultimately, you need to be at an ER. And I know where we're located, there isn't an ER near us. So it'll take a minute to, get to downtown. But that's something I really want people to learn, is to learn the difference between when to go to a prompt care and when to go to an ER.
So, let's do that. I mean, I don't know if you could think on the fly, but like, what's some reasons you would think, well, give me some situation where you should choose the ER over urgent care?
Chest pain.
So chest pain, definitely.
Severe chest pain. If you have a severe cardiac history, you've had open heart surgery, you have caths, you've had stents put in, things like that. Like, go ahead and go to the ER. Head injuries, that is our number one thing. So we do offer X-ray. Mm-hmm. We do have an X-ray tech, and they are capable of putting you in splints or putting you in a boot or something like that until we can get you to an orthopedic physician. But head injuries, let's say, grandma came in, she fell and hit her head in the bathroom. We can't do nothing for grandma with a head injury. She needs to go to the ER because she's going to need a CT. We can't rule out any head injuries. We can't rule out any brain bleeds. We can't do that there. And come in there and she has a brain bleed, you're delaying the time in her care where she needs to be at the ER getting that CT done, and you bringing her to a prompt care. So heart, head, those are about the top two. Well,
give me a reasons that you should. So when should you want to pick urgent care over ER?
I think I have COVID. Okay. I think I have the flu, strep throat. Oh, I failed.
Toothache?
Yeah, yes, but there isn't really much we can do. Not a dentist, really. Yeah, so we can maybe start you on antibiotics or something like that until you can get to the dentist, but there still isn't much we can do for that there. I think I have bronchitis. Can I get a chest X-ray? Yes, we can do that there. Okay. So things like that. That
makes sense. And I've been to urgent care. I actually went for a toothache before, and you kind of can tell a difference between urgent care treating you and then a dentist. Mm-hmm. They did a good job, but I was like, they're not dentists. They can't tell you everything about your mouth.
Okay, we can give you an antibiotic so you don't get an infection. Right. But you need to go see your dentist.
Right. He numbed me up with something. I'm not gonna lie, that really it hurted at the time.
Yeah.
But it felt good later on. And like I said, but it's like putting a Band-Aid over something. It's not really curing it. It just kind of holding you up for a moment.
It's kind of holding you over until you can get to where you need to go. Yeah.
Right. So okay, so that's definitely a good. That's a good. That was a good segment right there. 'Cause I didn't know that certain things you shouldn't go for. I actually had a friend of mine who recently passed away this year, and I think he went to urgent care a few times first for something with his head. He said he having these weird bad headaches. And I think he finally they kept telling him yo, you need to go get this.
You need to go to the ER, get a CT,
you want to go. You get this prescription. You think you're gonna, you think you're gonna be all right. And he had meningitis.
Yeah.
So he ended up, when he did go to the ER, he didn't come home for 3 months. He went back, and then, like I said, he never made it back home.
He needed that lab work and needed to be started on antibiotics and things like that. And that's something that we, we can only help you to a certain extent. And we can give you the steps that you need to take to get the help that you need. But ultimately, it's up to you to, you have to pay attention. You got to listen to what we're telling you, because I promise you, we're not going to tell you anything wrong.
But that's the thing. I think that's one of the things that people don't like. I remember him telling me, I think he didn't like, he was like, well, they can't really tell me nothing. It's they not the ER. Though. They not. That's not what they specialize in. They specialize in helping somebody for the time being. It's not like you gonna go to a broken leg, you gonna leave out with your leg not broke no more. It's not that kind of thing, So I think that's the main thing. They really understanding what each facility does.
Yes.
So I want to get into some of the COVID now. So what, if any, did they ever give you any kind of training on how to deal with patients with COVID? Is that, I'm pretty sure that's a main focus for most, I guess, for right now. So is there any penetration as far as when you're dealing with COVID patients, this is how you deal with them?
Besides donning and PPE, no.
And what about the test? Like, cause did y'all do rapid tests too?
We do.
How accurate are those though? Like,
so rapid testing honestly depends on the viral load. So if, let's say, you were exposed to someone yesterday, 2 days later you start having symptoms, and you come in that same day and say, well, my symptoms just started today and I want to be tested. I'm about 90% sure it's going to come up negative, but you may actually be positive. But the viral load for a rapid test is just, the sensitivity for it is so high that you have to have so much in your body before it'll turn positive. That's why a lot of people are like going out trying to get PCR testing, which can detect any amount of viral load in your body, versus a rapid test, which is kind of you have to really be sick at the moment for it to turn up positive.
I went to, I don't know what urgent care was, but it's pretty much like urgent care. They all kind of say urgent care, but different facilities, whatever. And I went to one, and I went like on a Friday, and I went, and it said I didn't have it. And I was like, all right, cool. But honestly, I didn't want to have it. Like, I wanted to work. I was like, oh, I gotta work, man. I gotta get the money. You know what I'm saying? And then I started
feeling worse.
I was tired, but anybody know me, I'm always laughing, joking. I was just snapping. I snapped one day, just snapped on everybody. I was like, let me go get another test because something ain't right. And sure enough, on Monday, the next day.
And it was positive.
I don't know if you saying load too, and I'm not a doctor now. I don't know none of that stuff. But the only thing I can say that I did differently was when I went Friday, right? I had I kept like, I was sneezing, but like I was when I went back, I dried my whole nose. I dried it out. I just dried. So when they like, it was nothing there. This time, so I ain't blowing my nose. I ain't doing nothing. I'm gonna have it this time. You know what I'm saying? And sure enough, I had it. And I don't know if that played a factor in it, but I was like, okay, maybe they needed more or whatever to see I had it or not.
It needed more time to build in your body, to build in your system, so that way it can.
The testing part, like, do you have a problem with that? And I only asked that because I feel like I got two different tests from two different people. They got the same test, but they did it differently. One was more aggressive than the other one.
So it's supposed to be a nasopharyngeal test. So that swab is supposed to go all the way back. No. So if anybody ever went to like one of those testing sites, like
when they first started,
and they would push it all the way to the back of your nose, like that was that PCR test, and that's how a lot of people remember it. Now the rapid testing, you go up there, but you don't have to go as far up.
Yeah.
And some people like that, and some people don't. Some people feel like you still supposed to, like, that's what I say, don't tickle my brain. Like, don't pick any brain matter. Oh my God. Like,
when I was in urgent care, the first girl that did it, I don't get I say it because it's entertaining, it's podcasting, right? I did feel like she had some other motive because she was talking a little bit too much. She just kept asking me stuff about my kids, and I don't know why you asked me these questions, whatever. And I kind of jumped back a little bit when the first time she did it. So she just kind of like, she never went up again. She never went up again. Nah. But the second one, I was like, I'm gonna put my chin up real quick. Yeah. Let her do her thing. But so it was just two different tests, you know. I feel like they were more
and a lot of people do that. And the easiest way to make sure that they, especially in our office, that they can't like do that jerk back, we tell them to put your head all the way back to the wall. So, I mean, once we start swabbing, you can't go nowhere. Your head against the wall. So
it hurt just thinking about it. Ugh.
Like, yeah, but if you want us to do it, you got to do it the right way. And some people are just like, well, can you swab right there? Like, no. If you want us to do it, let us do it the right way. And the right way is for it to be uncomfortable. It's not pain. It doesn't hurt. It's just uncomfortable because, something going up your nose. Who wants that? Nobody. But that's the way they choose to do it.
So, so I'm gonna just talk about the last couple months before this resurgence, right? Mm-hmm. How has urgent care been like? And I know, any typical day got its busy days, it got its unbusy days, but what's the I guess for you pros and cons just working there? And I'm asking because we gonna get to the COVID part and how people should deal with you then, but I'm asking for do y'all? I guess would y'all call y'all people patients or customers?
We call them patients.
Okay, I don't ask because they pay. We got to pay every time before we get back there. So yeah. All right, so you got your I'm about to say customers. You got the patients. Like, how do y'all what do y'all want patients to understand about y'all's job? Because I'm pretty sure y'all get a lot of upset
Attitude.
customer. Jesus Christ, upset patients. You know, so like, what do y'all want them to understand about your day? Like, walk me through your day. I guess. Like, walk me through a real busy day. Walk me through a busy day.
So I'll walk you through one of my recent days. So getting to work at 8:00, and getting to work at 7:45 because we open at 8. So getting there, about 15 minutes early so you can get stuff set up. There's already 25, 30 people lined up outside, waiting to get in. So this is before we even open.
You got the car pissed off already, but go ahead.
Right. You pull up and you just like, shit. So you already know what type of day it's finna be. So, open the doors, our registration people get them checked in, and we only have 7 rooms. So we're filling up 7 rooms with a patient. Basically, each patient wants a test. Each test takes 15 minutes to run. So we're getting them in, testing them, putting them in the room, but you have to wait 15 minutes. And once we get those 7 rooms filled up, that's when the registration people will start telling them, like, all right, we had an hour wait. All right, we had a 2-hour wait. We had a 3-hour wait. But people are still coming, which is fine because we're going to get everybody seen. Everybody who walks through that door, no matter what time we close. If you are checked in and on that schedule, we're going to get you seen no matter how long we have to stay there. So if we close...
Y'all salary?
No, we hourly. So we close at 7, and if it's still 20 people out there that got to be seen, and it takes us to 9, 10 o'clock to do it, that's just what it is. And y'all still
expected to come back tomorrow at 7:45 a.m.
And we still expected to show up the next day and do it all over again.
And that's mild, but I mean not mild. Like, as far as you explain, I'm pretty sure there's more to go into that because you don't talk about COVID. You still got people that's coming for.
We still got people that come for
elbow
other
hurt,
things, right?
Ear infection.
So, we have people who's sitting out there waiting 4 hours who, got or fail or got hip pain or something like that, but they gotta wait 4 hours behind people who just want a COVID test.
So I want to, because you just said a lot, and I put my phone out. So you said it takes 15 minutes for a test, right?
15 minutes.
Let's say test. So 15 per test, and you said sometimes you come out there's 30 people lined up out there.
All right.
Mm-hmm. So you got 30 times 15. I'm pretty sure all them people got COVID. We're just gonna say that. Mm-hmm. That's 450 minutes. All right. So you divide. Let me see. So divided by 60. That's already 7.5 hours just from the. It's not even 8 o'clock yet. So already you got 7.5 hours of just COVID alone. It's not even thinking about the person that got into a car accident just coming to urgent care. They got a headache coming to urgent care, even though they shouldn't. You said go to ER, but that just was coming to urgent care because they got a job they got to do. So they think they want to get a physical. There's a lot of stuff you go to urgent care for because you don't have insurance, so it's easier to.
Yep.
That's a lot. That's a lot.
That's
a lot of backup. 7.5 hours just in the first 15 minutes already.
Yes. So we have multiple machines, and we can run them concurrently, or we can do a read now after it sat there for 15 minutes or whatever, and then we can get the results. But we're running 3 and 4 hours behind schedule, and we only been at work for 2 hours. Right. And we're seeing 130 people a day, and we have to triage each patient. So we have to literally we have to physically talk to each patient that walks in that building. So we're sitting them down. We're getting their vitals. We're getting their medical history, the medications that they're on. We're, going over their past medical history, understanding why they're there today. Yeah. And that's another thing.
I was going to ask you that, because you still have to give them, quote unquote, attention. That's the thing. Not just say, okay, who getting tested? Let's come test. No, you got to do all the proper steps. So that even that 15 minutes, probably longer than that when you think about it, because you got to treat every customer, treat every patient the same. Yep. And that's wild now I think about it, because I be running game. I be like, look, y'all take the COVID side. I'm gonna take. You can't do that because it's medical. You got to go.
It's first come, first serve. Whoever shows up first and whoever signed in first, that's who we get. I mean, we prioritize different things over, people who are just there for basically COVID symptoms. So, somebody who coming in that say they're having shortness of breath or chest pain. Like, yeah, we're gonna give them that attention as soon as they walk in to make sure we're not gonna make them sit there for 4 hours.
Right.
And they saying they have chest pain.
But see that to me that would go back, and you a Holton body, you're gonna do this, but all that kind of ties back into what you're saying with the honesty part, because you're gonna have somebody who probably gonna see this right now and be like, okay, bet I'm gonna do next time. I'm gonna say I got chest pain.
Right, I'm gonna say I got chest pain so I can hurry up and get back there.
But meanwhile, as somebody who don't have chest pain not saying it, and they could be having chest pain, but they just like, I'm gonna just follow lines.
Yep.
That's kind of wild.
Yep.
Dang, that's crazy. Now I think about it. Good idea. I ain't gonna use it though, but that's crazy though. Damn. All right. So all right, y'all. You come in, you got all these patients, whatever, and the case may be. So like, how y'all make the game plan when y'all first walk in there? I mean, I'm pretty sure now it's the same every day, but like when the resurgence happened, like how did it hit y'all? Like, when did you feel like, oh, it's getting crazy, like it's too many now?
So where my location is, we didn't see a lot of people on the daily. So sometimes we'll sit there, we might see 12 patients in 12 hours. We might see 9 patients in 12 hours. But when we got to the point where we were seeing 30 patients a day, 40 patients a day, we was like, okay, something going on. 50, 60, 80. And then it was like, okay, something's going on. And then with the news, oh, COVID's new strain is out.
Yeah.
Now we got the, what is it? They had Delta, they had this, they had that, like, and it's like, oh my goodness, it's getting real again. And ever since then,
it's been nonstop.
It's just been nonstop.
So, I know we kind of skipped over it because you gave me your day. So, but you give me your day, right? With the kind of patients you see on a daily basis, like what's some things, I guess, from y'all side that kind of like you feel like patients or just general people should be more sensitive about? And I say that, I'm saying that to say better words, like how you think they should treat y'all versus, y'all gonna treat them the same. Yeah, y'all not just throwing something at them. Y'all don't want them to wait. If y'all get them in and out, y'all get them in and out.
I mean, we do the best we can. We move as fast as we can. The providers move as fast as they can. Patience is the number one thing right now, because just like, you don't feel good, it's 100 other people in here who don't feel well either. I mean, we all trying to do our best to get everybody seen in a timely manner, and we're here to help you. We're not here to hurt you, but, when you complaining, having a bad attitude, being, rude to us, and we're the ones that's here day in and day out, sun up to sundown. I leave my house, it's dark in the morning. When I get home, it's dark.
Right.
I'm in that building all day doing my best to try to help everybody. And I mean, the biggest thing is just patience. Like patience and being kind. Like it can go a long way. Just saying thank you. Like just saying, a patient today, I had someone, it wasn't even a patient, it was the person that was with her, just being rude, being nasty for no reason. But the next patient came in and she was just so appreciative. She was, everything we did, thank you. Thank y'all for your service. Thank you for everything y'all do. Like, thank y'all for seeing me, for take caring of me. Like that, that made it all worth it at that moment. Like anything else bad that happened earlier that day, it ain't even matter no more, because you had that one patient that was just like, thank you.
Yeah. I definitely can agree on that tip. Sometimes you be over. You have to when you contemplate work more when you at work. Like, is it really? Do I want to do this? Do I want to do this? What can I look for? But then the time you get that one person, it could be both ways. You get that one person. You get them couple people that like give you their ass to kiss, and you like, this is why I don't want to do this. But then you get that one person that one person that's appreciative.
Or we
get
like,
that
damn child that come in that want to laugh and play, and they don't feel well. But just seeing them happy, like just seeing them happy and all of that, like it makes it so much more worth it.
I definitely I agree with that, because you had something on Facebook, you like prompt care etiquette, you know what I'm saying? I think that's another thing when you think about, and it's not to be rude, when you think about all the patients y'all are seeing, how like that, and we said 15 minutes, but really had to time it, the average time per patient may be more than that. 15 is just a good thing to calculate.
Yeah, 15 is just for the test.
That's real quick.
Yeah, the average time per patient if you get there early, you may get in 45 minutes, but if you come with all the stragglers, like, you're gonna be there for hours.
And when you think about it, it's like, okay, well, we don't, like you said in your post, I ain't gonna read everything, but you pretty much like, some things we don't have time for. I don't be that it's irrelevant to what's going on.
Yes, and it's not to be rude, but it's a time thing.
Right.
So like when I bring you in and I'm asking you like, what symptoms are you having today? And you already start out, well, 2 weeks ago, no, like. What made you wake up and come in here today? Like, what made you say, you know what? I think I need to get up and go to prompt care. Why? Why did you say that? Oh, because your throat started hurting a little bit more than it was. Or you start coughing a little bit more. Like, that's what we want to hear. We don't want to hear, I was around my sister, auntie 3 weeks ago.
I can definitely say that. One thing I can agree with, and I can't compare medical to like retail too much, but I get that same vibe when I'm talking to a customer or whatever, and I'm asking them what the issue. I gotta go up there every issue. What's the issue? That's a bunch of issues, you know what I'm saying? And they say, well, let me tell you. 4 weeks ago, I'm like, no.
Yes.
What do you want? You want money back? 'Cause I can do that right now. I don't need to know the whole I mean, it's cool to know. Don't get me wrong. But you see, it's 5 people behind you. This lady need me. This lady need me.
And you want to start with 4 weeks ago. No. Real. Why are you standing in front of me today?
All that for 10% off. Like, man.
All of that.
Just tell me what you need so I can get the next person.
Yes.
Or I can do what I got to do. Because, like, it's just like y'all dealing with these patients and that's in front of y'all. But I'm pretty sure, even when y'all have 12 patients a day, it's still stuff you got to do in database. You got to check this. It's inventory you got to check. You got to make sure this is right.
Well, and it's not only that. It's... Yes, we're pulling the patient back. We're triaging them, getting their medical history, putting them in the room. But we're doing that for 7 patients. I'm going to just use 7 rooms. So we're doing that for 7 patients. But we also have to do other stuff on the back end, too. So, yeah, we got you in the room. But the patient who was here at 8 o'clock, they need to be checked out. They need a shot. And we got to document that shot. We got to, we got to draw it up. We got to put this in, put that in, print out their paperwork, give them their paperwork. Oh, they leave, they come back. Oh, they need a work note. So we're literally like bouncing off the wall all day long. It's not just one thing. It's not just we deal with you that one time and put you in a room. We dealing with you from the time you walk in that door to the time you walk out. We're giving you everything you need.
I do got a good question then. I think about it too. Like, and you tell me like, cause I can only speak from the patient side of things, right? For urgent care. So like, what's the process like when we come in there? I'm only talking for when it's not 30 people outside. You know what I'm saying? You come in there, okay. You walk to the window, I guess, or whatever, and you tell them. Well, I don't know. I don't know what they ask me, but let's say they ask me whatever. They give me something to fill out. I go sit down. I fill it out. Get back to them. I ain't gonna lie. The only thing I never liked about urgent care is that time from when I give you that form to when you call me. And I never like I don't get nasty to anybody when I'm out. You know what I'm saying? I don't know what your job entails, what you gotta do. But I definitely be on my phone complaining to them. Like, damn, I've been here for a long time. Like, yo, they keep looking at me, ain't calling me back yet. Da da da. Or somebody might come before you and you're not knowing the process of like, well, I should be second because I came in here after this lady, but 2 people that went before me. Right. Like, what's the mindset of?
So most of the time when that happens, all our rooms are full. So all of our rooms are full. We have nowhere to put you. So you have to wait until somebody is let go or checked out. But let's say we're working with a provider who's not the fastest.
Got you.
You got to wait. And we deal with that too. Like working with a provider that's not the fastest, we got to wait. We have to wait on them to do what we do. So we can't do what we do until they do what they do.
When you say provider, you mean like the insurance company?
The doctor.
Oh, okay.
So the doctor, the nurse practitioner, the physician assistant, whoever comes and treats you, like we have to wait on them to take care of that person so that way we can do what we need to do to get them out of here to get the next person back.
Got you. So all right, let's talk like staffing type thing too, 'cause I think that's very important when we think about time and what can and can't be done. How y'all, and maybe just you, maybe any urgent care you know about, like what's the staffing like? Kind of retail is horrible, but for like y'all, like what's the staffing like?
Short.
Anybody want to come to work?
Short. People are getting sick because of what we do. So
more time out.
I mean, they have to take time off to get better too. So So because so many people are getting sick, like we've had to consolidate all of our staff. They've
seen
closed
that. Send y'all all to one.
Yeah. So
Gotcha.
they've closed like several of our locations because there was only one MA at each one. So why have all 3 of these buildings open, stressing out one MA at each when we can close these 2 and send all 3 to one? And everybody, like patients, just have to come to this one if they want to be seen.
And technically speaking, it's probably the best because if you stress that one MA out, then you got to close that one down anyway because they ain't there. You can't do
right.
nothing.
Then when they slide that 2 weeks to you, then what you gonna do? So yeah, very short for sickness reasons and for staffing reasons. It's just not enough for us.
So give me the hierarchy. Like, is it so the people at the desk? They got because everybody got scrubs on. So I don't know who's who. All right, people at the desk. What do they? They just admin. They just doing registrating me or whatever.
They're running your insurance.
Calling my
they're
insurance company, make sure I got
co-pays,
ringing me
putting
up,
your information in, like making sure everything's up to date. Like that's what they do at the front. And then you have the MAs at the back.
How many of y'all will be in one?
So on a regular day, it's only 2 of us working on a regular day. Right now, because of the surge in cases, it's 4 of us working.
But it's at one facility.
At one facility.
So it really don't matter then, technically speaking. Yeah. Okay. So it's not less work. It's just somewhat of a less headache. But y'all all just run around all day.
We all just run around.
Gotcha.
Though. Like we're all just.
But instead of being stressed out on just one, y'all all kind of put their heads together. Yep. But it's still stressful. Got you. So it'd be 4 MAs.
Yep, 4 MAs.
And what y'all do?
So we're the ones that when we pop out that door and call your name, we bring you back, we triage you. So getting all your history and stuff like that,
weight, all that
your
stuff.
weight, height, putting all that stuff in. Why are you here? Getting all that information. Then we sit you in a room until the physician comes to see you. So whether it's the MD, the NP, the PA, whoever the provider is that day, they're gonna come in, they're gonna see you. You know, oh, what's going on? Why are you here? Listen to your lungs, listen to your heart, look at your eyes.
How many of those are there per day? I'm gonna call them doctor because I don't know the verbiage, but you said MD.
So on a regular basis, it's normally 2.
But they're doing different shifts, so like one or they on the same shift.
No, all the same shift.
Oh, okay.
Yeah. Normally it's 2. Lately it's been between 2 to 4.
Okay.
Because
so we'll say 4 MAs, 4 providers, and technically speaking, that's kind of still not even enough to keep to have y'all on track. Y'all still kind of behind even with that. And
I mean, honestly, it's just gonna always be behind because of the size of the facility. We can only do 7 to 9 at a time.
Right.
So.
Wow, that's crazy. That's crazy. And I guess too, thinking about it, I don't think anybody coming to the urgent care or coming to the facility is thinking about the staff in there, what y'all can and can't do, how quick y'all can and can't do something.
Right.
So a lot of times if you go in there and you're there for 2 hours, you might think, damn, it's been 2 hours, but really, you should be thankful for 2 hours because it could be 6.
It could
8,
be 6.
You know what I'm
saying? That person who just walked in the door, they finna sit here for 5.
Right.
Like, yeah.
Right. So yeah, I definitely get what you're saying about the etiquette and kind of just gratitude. Like, hey, we could just leave right now and then we won't be nothing. Won't be nothing.
Right. It won't be.
You know what I'm saying? So. And I would assume too, like the providers. I'm gonna call them providers because you said 3 different names, but they also have to talk and make sure that patient is. So like you said, that them stories, them 2-hour stories they want to tell you is like
that takes time. Right. Yes. So if we have to deal with you first for 10 minutes and then the provider has to deal with you for another 30 minutes, like and don't need an X-ray and then we gotta wait for the radiologist to read it. Another 30 minutes, like you
holding that room up, really.
You holding that one room up, yeah.
And I think people need to kind of watch this and kind of get an idea of where they go to because I think my kid's mom was telling me the other day, like she went to go get a test, and I think that she had a toothache or something like that, and I think the thing with that was like I'm in here with all these COVID patients though, so it's like. What you normally would go to the urgent care for in and out quick, you really can't even do no more because you risk the chance of even catching COVID because you got all the patients that got COVID. It's not like one of them things that got the sick side and the whole room is sick. Just assume
the whole room sick. Yeah,
right.
Assume the whole room is sick, and I mean, only thing you can do is just wear your mask.
How is that for y'all? Like, is it scary? Like being like being around that much COVID during the day, like throughout the day?
In the beginning it was only because of the outcome of COVID at that time. So if you notice the difference between COVID now and especially with vaccinated people is like they just feel like they have like a little sinus infection. Oh, I just got the sinus pressure and the drainage,
Right.
and I just got a sinus infection. But back then with COVID, you got COVID, you was in the hospital fighting for your life, trying to breathe, being put on the ventilator, like stuff like that. So from then till now, it's not as nerve-wracking if you do catch it. But, I mean, it's still nerve-wracking because who wants to catch COVID? And
That's depending on what you got.
Yeah,
already.
the big hype right now.
I guess I can ask you because you in that field. Like a lot of people be asking this question on social media and stuff. Like, does the flu still exist?
It does.
Okay,
the flu does still exist. If people haven't been watching the news, two things about the flu this year. One, the strain is a mismatch to the vaccine. So basically getting the vaccine was kind of a dub because, I mean, it really didn't do anything. And hearing about the flu Rona, like they're causing panic about hearing,
it's
you
like
can
a compound
have
word now.
Right, like, you can have flu and COVID at the same time. Yes, you can have flu and COVID at the same time, but it's nothing new. We've been seeing this for months and months for people having like COVID and flu A, COVID and flu B, or sometimes having all three, COVID, flu A, and flu B. Sometimes you're just a little more sick. Your symptoms are a little more severe, but
if I'm not mistaken, I could be wrong. Kind of all that got the same symptoms.
All
though,
of
right?
it has the same symptoms.
You could be diagnosed with COVID. You could have COVID and the flu.
Yeah.
Okay, and you just don't know.
But unless you test for it. So because the symptoms are the same, when we do COVID tests, we do flu tests at the same time because you don't know which one it possibly is, and that goes back to a time thing too.
That's more time.
We don't want to. We don't, because it takes 15 minutes for both. You don't want to do a COVID test, wait 15 minutes, and then it's negative, and then it's like, oh well, maybe it's flu.
Let's check that out now.
Let's check that out now. No, how about we do it at the same time? We'll get both the results back at the same time. So that way we'll know, yes, it's this or that, or it's both.
Right. Geez, that's a lot. That's a lot to deal with. Like, I guess this is more like just for you. Like, do you feel like, is this still something like what you wanted to do? Like, and I know it has its stressful times, but like technically speaking, when you started out wanting to get in the medical field, like what was your main reason? Was it to help people? Was it for the money? Or was it for the position, career?
It was... I guess because of what I wanted to do, my passion was always mental health nursing. So having that touch of psychology with the touch of the medical field, that's what I wanted to do. But, working in a prompt care, it's okay.
But right now,
yeah.
I'm pretty sure nobody expected COVID to happen. Like, you didn't expect it to be.
Back then, you didn't expect, if I get into the medical field, what happens if a pandemic hits? Like, how will I handle that? You don't think about that. You just deal with it as it comes along. But, I mean, it's just what come with it. So
I wonder if it'd been like a big push in medical school. Because, you always hear about everybody in medical school and all this, that, and third. I wonder if they changing curriculum to kind of get staff in the bed. I don't know. Like, I just wonder if they doing something like that. But then you can't rush that. You can't rush the process.
Yeah. Not with that. You can't rush the process.
Yeah, it'd be interesting. I would be interested in knowing more about that. But I mean, all in all, like just with working in urgent care, and this, like I said, this is Augusta. This is pretty much like a medical town anyway.
Yeah.
When you think about the jobs, the teachings you can get, the schooling you can get on medical, and just in general. Even when COVID first started, Augusta was in the report for a lot of time for finding having a lot of great findings to deal with the virus and what have you. So, I mean, I always say like, if you in good hands in Augusta than you are in most places anyway.
Yeah.
So that's even more reason to want to be appreciative of everybody who doing their job here, in my opinion. But I just wanted to. I kind of definitely wanted to get that side of things out, like what y'all go through, because I think we hear so much about the patients,
right?
Everything involving COVID. And I do media, so like I've talked to people who had COVID, who dealt with somebody who had COVID, somebody who passed from COVID, about the vaccine. it's everything surrounding COVID, but except the people who are helping people
with the COVID,
right?
Yeah.
on a daily basis. You know what I'm saying? Because
Yes.
that just COVID just kind of y'all already had enough on y'all because it's health. COVID kind of threw more, and it's like triple the load.
Yeah, and like I said, when COVID first hit, the way that people were going into the hospitals and the ERs in record numbers, like the hospitals were getting the recognition. The RNs were getting the recognition, like title wise, the MDs, the RNs, the respiratory therapists, like they were getting the recognition, and nobody really looked at us at prompt cares. Right. Like we weren't recognized for the work that we do and the work that we did back then. And even now, like because COVID, the symptoms, how they're showing itself, it's not sending people to the ER. It's not sending people to the hospitals. It's sending people to prompt cares and things like that to be tested. And nobody's recognizing us. Like nobody's thanking us. We don't see pretty much any extra money from it. Like the money that everybody else was making because of a pandemic, being recognized as healthcare heroes,
essential workers,
getting hazard pay and
it don't
stuff
get more
like
essential
that.
than y'all, so.
It don't get any more essential than us at a prompt care swabbing these patients day in, day out for 12 hours, and we can't even like get a thank you, or if we do get a thank you, it's kind of just like, oh, thanks for showing up.
I know, right?
And
see you tomorrow.
And that's it, right? Thanks for showing up. You're gonna be here tomorrow, right? Like, yeah. I guess
that is wild. So I guess in my finishing stuff, like, so when I know you said that y'all see all patients, whatever. When do the doors actually close though?
So,
I'm only asking that because I'm pretty sure that has a lot to do with like how y'all feel, attitude, demeanor wise, as far as like just toward the job. Because if y'all say normal hours are from 8 to what? 8 to 5, 6, 7, 8.
We are open from weekdays 8 to 7. That was our normal hours. Right now, because of how things are going,
COVID hours.
Yeah, our COVID hours, we're 8 to 5, and then weekends 9 to 3. So what happens is, once we lock those doors, that's it.
Okay, that's what I was gonna ask. So it's like, y'all get everybody that's inside the facility.
Yeah. So
if you come inside 4:59, you in there cool, but
5:04
and you locking the doors.
And she put you on that schedule, you good. But yeah, 5:04, them doors locked. That's it. That's it to the next day.
You gotta have some kind of cutoff time though, because they don't. Y'all be there all night.
We will be there, and we still there all night half the time.
Right. I did wonder, and I don't know. They probably should look into having some different shift type thing, but then I feel like if you did like 24 hours, I want to work the shift of overnight. I wouldn't want to work because nobody would come in there overnight really. In my opinion, I don't know for sure, but I do feel like
depending on
it could be
location.
less stress on y'all, but then like you never know. Y'all come in at 7:45 and all the patients out there. I don't want nobody going home until everybody settled. So it depends. But like you got any like I guess like final words just on like your job and what you want, like how you want people to kind of treat y'all. And
like I said, the biggest thing is a thank you could go a long way. Like we spend hours on our feet every single day, like trying our best to help everybody, whether it's COVID or non-COVID related. No matter what it is, if you walk in our building and you're checked in, we're going to see you and we treat you with the utmost respect. We ask for the same thing in return. We're missing lunch breaks. We standing in closets eating real quick. Like, let me go bite my food and come back because I got to type this in the computer. Like,
right.
We deal with a lot. It's not easy. It's a very stressful job, but everybody that I work with, I know that we love our job. We love what we do. We're there to help, and we're always going to be there to help, but kindness.
Definitely. I would say that if you see whether it's anybody that work in the medical field, just you gotta know where they work at. Just see them with scrubs on. I would definitely say just tell them thank you for whatever you're doing.
Yes. Because
even if they just doing, they working high, but they doing trash. They still doing something there. Conducive to it. It's a machine.
They still there.
So I would definitely say thank you. And I'm gonna start doing that if I see them at work too. Because I do it sometimes, but like just on a daily basis. You know what I'm saying? Because you don't think about it until like me having this conversation just now. Like damn, I do go through a lot. Yeah, I do think a thanks go a long way. And I was gonna ask you that too. I always say on camera, I ain't got nothing on me to give you, so I was not gonna like give you something on camera though. But when we get done, if you could like tell me, off air, of course, the location where you work at, whatever.
Yeah. I
would like to. I mean, this is more massive. I can't speak on other entities, whatever. Yeah. But I would like to like at least buy y'all lunch one day or something like that. It's just I think it's good to get something to come there. Yeah. Y'all ain't gotta leave. Y'all sneak and eat in the closet, whatever. But at least it's coming to y'all, so y'all can do y'all thing, whatever. But when we get done, let me know and I'll either give you the money or I'll see how we could do it, whatever. So it. Yeah, I try, I try. But this was a dope conversation. I told you would do it. You was it was good. Like you was good. You ain't from the beginning to end, you was good the whole time. So
goodness.
That's what's up, man. So appreciate you for stopping by, talking, man.
No problem.
I do think it's very important. I'm thankful for everything y'all do, especially urgent care, because I always go to urgent care.
Yeah.
And I got insurance. I just be going because I don't feel like going to y'all like. But I ain't never had no head trauma like that. So if I do, I know I'll go there. But
please,
it was very informative. I hope that anybody watching, the main reason was for this to get information, not so much on COVID, but that was good also, just on how to treat the people you going to see. Yeah. Because they come and treat you.
Yeah.
So that was it, man. I appreciate you stopping by. All right. More Than Matters Podcast. We out.